Welcome to the Seniors Flourish podcast, where it's all about helping occupational therapy practitioners working with older adults be the best they can be. And now your host, Mandy Chamberlain.
Welcome, everyone, to the Seniors Flourish podcast. I'm Mandy Chamberlain, occupational therapist, and your host for today's episode. Today, we're going to be talking about 5 tips of the trade to overcoming patient refusals. I wrote an article last year kind of giving some ideas and tips because people have a lot of problems with getting patients to participate, especially if they're working in long-term care and they have minutes and there's supervisors that have pressure to get them to see the minutes that they need to be seen. There's RUG levels to adhere to. There's ethical dilemmas that they need to kind of resolve, like how do I provide the quality of care? Patients don't want to be seen. Should I be providing this care if they don't want to be seen? And so I'm just going to be giving a bunch of tips, 5 to be exact, on different ways that you can kind of work on some of these issues. So the first tip that I'm going to be giving is splitting up your minutes. Sometimes we have a lot of minutes that we need to be seeing patients, right or wrong. That's a whole nother topic to address. But if we need to be seeing patients for a long period of time, and sometimes patients really just don't want to be seen for that long. So one tip is just, like I said, split up those minutes. So you could be seeing them in the morning for their morning grooming and hygiene, maybe at sink side. Working on some of those basic occupation-based activities, things that they're going to be doing anyway, purposeful activity. We can be doing lots of training with them, working on all sorts of components such as activity tolerance or fine motor coordination, etc. And then maybe we could pop back in at noon and work on some of their feeding over the lunch hour. So it kind of just breaks up the day a little bit, and that you can kind of see them for part of the day in the morning or the afternoon and kind of break it up if the idea of a long treatment session is just too much. And sometimes patients are just overwhelmed when they know they have to be in therapy for an hour long, and they just, not even that, sometimes they can't tolerate it. Sometimes they just honestly don't want to do therapy for that long. And so I think trying to split up those minutes is a really good strategy to kind of accomplish both goals, something that the patient wants and appeasing our minute standards. Like I said, right or wrong, just splitting up the minutes. Okay, tip number 2 is reviewing and going over the goals with your patients. So a lot of times we do an evaluation, we develop our goals, we talk to the patients about what occupational therapy is, we talk about what their goals are, and really trying to figure out and be as client-centered as we can and work on activities that they want to participate in. But a lot of time that has to do with, of course, cognitive level. But really emphasizing that we are a team, that my goal as the occupational therapist practitioner is to help them accomplish their goals. So if they want to be working on goals to, of course, go to a least restrictive environment, such as assisted living from a skilled nursing setting, then we need to work on all those things to accomplish that goal. Makes sense, obvious. But sometimes you just have to use your therapeutic use of self to determine the best approach to review these goals. I feel over the years I've refined this, and I am much, much better at it now than when I first started out as an occupational therapist. Sometimes patients respond to some kind of friendly conversation. They like kind of being a little, conversational and bantering and joking around. And some some patients need a strict, direct talk and say like, okay, what are your goals? What do we need to do to accomplish that? And what do we need, what's our strategies? So each patient is so individual. And so we need to make sure that we're reviewing the goals that we established as a team. And I can't emphasize that enough. We need to listen to our patients and see what they want and what they need. I may think that they need to work on dressing, but the patient may not find that as a priority. They are happy with staff helping them or a caregiver helping them get dressed. Even if I see the potential in them because of their, strengths, because of their, their cognitive level is, added ability that they could dress, or their fine motor skills, or the gross motor skills, or their balance, or all those things that I see like, oh my gosh, you could totally do that independently or do that with less assistance. But if that's not a goal that they want, then that is not something that we should be writing in our plan of care, and that's not something we should be working on. We need to really focus on being client-centered. And so sometimes just reviewing their goals with them and having, talking to them about, what is our ultimate goal and how do we achieve that? Just as a reminder, and just kind of bringing it all together and saying like, why are we doing therapy? Really, really helps. So that is goal number 2, reviewing their goals with them. Number 3, tag team your treatment sessions. Are you in an environment where you could provide part of the treatment in the morning, and then have OT assistant do the other half in the afternoon? I know this isn't going to be conducive for every environment, especially if you're working home health or if you're independent, an independent clinician in assisted living, or it doesn't really matter. But there are certain environments such as skilled nursing, where most places have more than one occupational therapy practitioner. And sometimes you can divide up the treatments by tag teaming. Sometimes a fresh face is all you need to get your treatment session in. And sometimes, unfortunately, patients respond better to some OT practitioners than others. So I may go in the morning and work on some, morning dressing and toileting and those types of things. And then maybe the OT assistant or the other occupational therapist can see them for the rest of the time a little bit later in the day. Like I said, not always conducive for every environment, but it can be effective if you work somewhere where there is some flexibility and you work as a team with your the other OT practitioners, and that you can kind of jockey that a little bit. Okay, let's go on to tip number 4. Do not overwhelm the patient. This one sounds very, very obvious, but I actually find this one to be one of the most effective tips that I just find it most effective. So basically, we sometimes will go into our treatment sessions, the patients are ready, they know you're coming. You're like, okay, these are the things we're going to be working on today. And we'll talk about all the activities that we're going to be doing, such as, we're going to be getting up from bed. If they're in bed, if they're still in bed, we're going to get dressed. Let's go to the bathroom. Let's kind of get ready for the day. And you try to tell them everything you're going to do in your treatment for the day, because you feel like you are trying to prepare them and let them know what to expect. But sometimes that's just plain overwhelming. And then people will be like, they shut it down. They're like, nope, I don't want to do anything. So what I typically like to do with some of those patients where it just seems like everything is overwhelming and then they just don't want to do anything is really just making sure that we're cracking out those activity analysis skills and really breaking down what is the first step that I want them to do. So if we have a patient that's in bed and they really just do not want to participate, I kind of start out by saying, hey, let's just start by sitting at the edge of the bed. Let's just see how you're feeling. This is really effective if someone's like saying like, I'm having a lot of pain, or I don't feel well, or my stomach hurts, or I'm really dizzy today. So just letting them take control of the situation and saying, just encouraging them to just do one aspect of the activity and putting the ball in their court and saying like, okay, let's just do this and let's just see how you feel. If you feel good, maybe we can do a little bit more. If not, we can kind of, back off. And I would say most of the time, not every time by any means, but most of the time, people are pretty comfortable with that, and they feel like they are in control of the treatment session, that you're not just going in there and bossing around and making them feel overwhelmed, but just really just breaking down that task and getting them sitting to the edge of the bed or wherever we're going to be starting with. And then really, listening to them and talking to them, asking them, how are you feeling? Are you still feeling dizzy? Are you still hurting? What's hurting? I really want to listen. I really want to know what's going on, so I know that I'm not pushing you too hard, and those types of things. So really kind of putting the ball in their court. And it really seems to work really well. And I think sometimes, especially if they're in a situation where they're, in a long-term care situation or a care where they have caregivers, or they feel that loss of control over their own lives, things like not overwhelming them and letting them be in control of the situation really helps them, because it makes them feel that we are listening to them, which we should be doing anyway, but also that we are, directing our treatment session to them and they are in charge, which again, sounds obvious and something that we should be doing anyway. But like really, communicating that with the patient. So my favorite tip is do not overwhelm, and use those activity analysis skills to break down the task and do one portion at a time. Much, much, much more effective. Okay. And the last one I'm going to be talking about today is number 5 on my list of tips of the trade to overcoming patient refusals is being flexible. Sometimes you go in there, like I was talking about in some of the other tips, like you have this idea of what you want to do with the patient. You're going to go in the patient's room and like, we're going to go down to the therapy room. We're going to do X, Y, and Z. And, sometimes the patients don't want to be in a group setting. They don't want to go down to the gym. They're in their, pajamas or their gown, and they really don't want to leave. So there are tons and tons of things that we can do to accomplish some of the same goals, or possibly work on other goals in the room environment. I am a huge proponent of working in their rooms when I'm working in skilled nursing specifically, because it's their environment, their space for the time being. They feel like they're in a little bit more control. And I feel like a lot of the treatments can be much more occupation-based in the room environment. And so, especially if you can be flexible, that is just a huge advantage. Not always a situation. Like I said, if you're working in a hospital setting or home health, or, you're on a time crunch or you're only seeing one patient in a certain facility, of course it's not going to work. But if we can sometimes be flexible, go in, or even like, they're like not quite ready, maybe I can sneak over and see a different patient and come right back. Or even one thing I really specifically like to do, maybe I should add this as a number 6, is if you can, which does not always work, but make sure or try to schedule appointments with your patients. Even in facilities, where they are living, even temporarily, they like to know that I'm going to be there at 10 o'clock, or at least I try to give them a time, a range from 10 to 12. And I used to do that a lot in home health because there's so many variables in home health. Sometimes you can set up your schedule and be like, I'll be there about 10, I'll be there about 12, and then like someone has a cancellation, or you're only going to see them for a half hour instead of the 45 minutes that you thought, or, weather and you're driving, or there's so many parameters. So even if you can give them a time frame and what works best for them and being flexible that way, it really is super helpful. So just kind of reviewing all the 5 tips for overcoming patient refusals. Number 1, split your minutes. Number 2, review their goals with them. Number 3, tag team treatments if possible. Number 4, do not overwhelm, and use those activity analysis skills to break down the task. And then number 5, be flexible, seeing if there's flexible in location of treatment, flexible in time, and trying to be as client-centered as possible. There's lots and lots of other little other tips that we could probably go over for tips of the trade to overcoming those patient refusals. So if you have any comments or any suggestions or additions to some of these tips, I'd love to hear them. If you want to add them in the comments underneath this podcast. But I always like to close with an OT goal based upon what we're talking about today. So the OT goal of the week is OT practitioner will complete 100% patient visits in clinical setting as measured by the number of patients on the practitioner caseload within 1 week. So if you just, work on using some of these tips to kind of see if we can get our patients to participate, it's not always because the patients actually don't want to participate. A lot of times there's all of these contextual or environmental barriers that contribute to not wanting to participate. So just kind of assuming that they don't want to is kind of not the right approach to take. Just looking at the patient as a holistic being, which is what we do as occupational therapy practitioners, and really trying to use our therapeutic use of self and figure out what our patient needs so we can be as client-centered as possible. If you want to head on over to seniorsflourish.com/patient refusals, you actually can get a free overcoming patient refusals quick reference guide. You can print that off if you feel like you need some extra little tips in the clinic. And I just want to thank everyone for listening to this episode today, and I look forward to talking with you next time. Thanks so much for listening.
If you are an occupational therapy practitioner that enjoyed today's podcast, I invite you to check out the Learning Lab at seniorsflourish.com/Learning Lab. The Learning Lab is the essential resource for OT practitioners working with older adults looking for more treatment ideas, support, and resources to be the best they can be. So whether you're struggling to find evidence-based treatment ideas, you don't have time to research for resources or patient diagnoses, or are even looking for ways to earn more professional development units, then the Learning Lab can help you become a more effective and efficient practitioner. With weekly educational videos, a huge resource and handout list, a bi-monthly journal club where you can earn professional development units, a supportive community forum, and even some exclusive member-only bonuses, the Learning Lab is the perfect place to help you be the best OT practitioner you can be. It's like having your own OT help desk. So check it out at seniorsflourish.com/Learning Lab. Thanks for listening. This podcast is brought to you in partnership with the Senior Rehab Project at seniorrehabproject.com.